Good morning, everyone. Welcome to our panel on caregiving, especially caregiving among elderly Asian Americans. My name is Victor. I'm the Chief Government Affairs Officer for the National Asian Pacific Center on Aging. I'm also joined by some of my colleagues who traveled around the country and want to thank APAICS for just hosting this very important panel on behalf of all of us within the community. So I'm joined by a very distinguished panel, Ms. Nancy Hoff from PNAA Foundation, Mr. Kam Mora, which is with CIRAC, representing our Southeast Asian Americans, and Ms. Rhonda Richards with AARP. So just want to take some time for our panelists to introduce themselves, starting with you, Nancy, if you'd like to introduce yourself.
Good morning. Can you hear me? Yes. Okay, thank you. Good morning. And I'm Nancy Hoff, President of the Philippine Nurses Association of America Foundation. And we're so pleased to have the opportunity to be here and talk about caregiving. So, is that okay?
Absolutely. And Kam?
Good morning, everyone. My name is Kam Moa. I am the National Deputy Director at the Southeast Asia Resource Action Center. CIRAC is a civil rights organization based in DC and with California offices that focuses on advancing the civil rights of communities from Cambodia, Laos, and Vietnam. Specifically, we work with refugee populations who have faced significant hurdles and challenges in the resettlement that continues to affect them today, including in the caregiving and the aging spaces. At our organization, because we are a policy advocacy organization, much of our work is around convening community-based and nonprofit organizations that work directly with senior populations and caregivers in order to help them unite their voices and advocate for better policies and solutions for caregivers and for the elderly. Thank you.
Hello, and I'm Rhonda Richards, Government Affairs Director at AARP, and I work on AARP's federal advocacy to help support family caregivers and help people live independently in their homes and communities where they want to be. And family caregiving is a top priority for AARP. We engage in state, federal, local advocacy, advocating on behalf of family caregivers and the loved ones that they care for. Family caregivers provide over $600 billion in unpaid care annually, and AARP just released a new poll last week about family caregivers and the large and important constituency that they are. They make up about 1 in 5 voters, and when you count voters who are current, past, or future family caregivers, they make up 78% of voters, family caregivers. So quite a significant constituency. And AARP also helps provide family caregivers tools, information, and resources through our Family Caregiving Resource Center and many other things. We also have family caregiving guides, including one in Chinese and one for Asian Americans in particular, to help families have conversations and plan for caring for a loved one. We also engage in research on caregiving, including among different racial and ethnic caregivers, which helps us see the commonalities that all family caregivers face, but also how caregivers may experience caregiving differently and need culturally inclusive and linguistically appropriate solutions and supports. And happy to be here today and appreciate APAICS holding this panel.
So over the last 20 years, caregiving has really changed significantly in how we care for elderly individuals, and the challenges have also shifted over time. And one of the challenges for the Asian American, Native Hawaiian, Pacific Islander community is there's a lot of cultural challenges and linguistic challenges that we're facing. And so my first question for the panelists are, what are like the biggest challenges that you all are facing? Could be cultural, could be linguistic, and how are you addressing some of those challenges? And I want to start with Nancy, because as president of the PNAA Foundation, representing Filipino nurses, you all are on the front lines for caregiving. What would you say are some of the big challenges that you all are facing, and how are you addressing those challenges?
Thank you. Thank you for this opportunity. First of all, I'd like to let you know that the foundation is part of the PNAA, or the Philippine Nurses Association of America. We are the group that promote and provide opportunities for philanthropy in order for us to meet and do the mission of Philippine Nurses Association, which is the development of the Filipino American nurses to their fullest potential, and facilitate the contribution to health and well-being for all through nursing care, education, research, and our humanitarian services. I was asked to kind of mention what we did during the time of the pandemic, because that really hit the Filipino nurses quite a bit. 30% of the death of nurses, during that time are Filipino American nurses. So because of that, in 2020, that happened in 2020, the Philippine Nurses Association of America, under the leadership of Dr. Mary Joy Dia, we formed the COVID task force and started what we call the Heal Our Nurses project or campaign, with the goal of assessing the overall state and well-being of our members and the impact of a pandemic to our nursing profession and the public. The task force gathered the lived experiences of our frontline staff from different regions and chapters through our survey that we called Emotions Behind the Mask. The overall feedback matched descriptions of individuals who experienced psychological trauma associated with loss of lives and feelings of helplessness. Some of our members reported exposure, and of course even getting the COVID-19, being on quarantine, and the demands for and lack of personal protective equipment. That was a big issue then. Feelings of fear, uncertainty, pain of seeing fellow nurses, family members admitted to critical care units, and grief were a common theme. Their greatest fear was infecting their families. Some moved out of their homes and shared apartments or hotel rooms with the other nurses who are also working during that time. There were feelings of trauma, there were feelings of fear of the unknown, sometimes anger, and stress and burnout happened. So the task force understood the immediate need to provide psychosocial and emotional support to their family, to the nurses' family and community. The stress or burnout of many nurses led to resignations, early retirement, and in some, change of professions. That's what they called the Great Resignation during that time. This led to more shortage of nurses around the globe. Mental health programs in response to the challenges faced were to strengthen their well-being. The Heal Our Nurses program had 3 phases, and they were phase 1, to meet the immediate needs, and that's listening, doing the survey, and psychosocial support. That was a priority. The other phase was the intermediate phase, which is educational awareness. And the last phase is the long-term phase that includes public health awareness and influence policy. And that's where we are now. The Philippine Nurses Association was fortunate to be able to be granted by the all-in well-being first for healthcare. What they did for us and helped us, it made it possible for PNAA to do webinar series, and that definitely made a huge impact for our nurses, especially for self-care. Because of all-in funding, the Resiliency Training Program started. Education webinars were produced to provide resources for group therapy. sometimes you don't see this among nurses because nurses just don't show it. But having this survey that we did allowed them to pour out what it is that they feel without really saying who they are or showing who they are. Wellness coach to support healing process and self-care programs and resilience training by Dr. Sood and other mental health experts became possible because of that funding. Self-care programs were important because nurses, especially AAPI nurses, think of others first before thinking of themselves. Ability to connect with friends and family through virtual socialization and networking were very helpful. Lots of Zooms and a lot of all those kind of meetings. What we learned to address the needs of caregivers from the Heal Our Nurses campaign during the pandemic most certainly applies and can be adjusted to be culturally and care needs appropriate. Example, family caregivers and caregivers for persons with dementia and Alzheimer's. Support and promoting resilience training are needed to better care for others. There are fundamental factors that we can all use in looking at what we can do for caregivers for any of these needs that we have. One is the availability of community-based services and facilities that are financially accessible and available in their area, locally and nationally. Support groups and resources, community programs, community outreach are important components of community adaptation to provide emotional support and identifying medical symptoms and stress. Cultural values among AAPI communities, feeling of responsibility to provide emotional support and to care for our parents or older age. That is what we have in our hearts. It's ingrained in our hearts of what we need to do. Multiple generations in the household. That, say, oh, that's good, but really, whoever is the person who is earning for the family, it becomes a big challenge for them. So we need to think about that. What we call sandwich generation, taking care of your parents and taking care of your children. Religious beliefs. Church groups are trusted sources of support and education of caregivers. This is another one. Access to transportation. Whatever kind of caregiver, whatever care you're giving, we need to have access to transportation to get community-based services, to get to community-based services and facilities, and to attend support groups. This is for caregivers. The language barrier. The language barrier. We thought, oh, we have a lot of linguistically appropriate information there, but actually we don't. We still need more. So not only about information about where to go, but to know about the disease or problem of the person you're taking care of. We don't just take care of their physical needs, but we need to know what they truly need. Linguistically appropriate training on caregiving, including medical administration and nutrition. And shall we have incentives for them to take or find the training and also to be able to have annual competency validation. Linguistically appropriate information on access to important resources like social services, senior centers, and professionals who can provide expertise and provide education and support for caregivers. And in cases of caregivers with dementia or Alzheimer, we need psychologists and psychiatrists also. I'm almost done, because Victor told me I can just go finish the whole thing that I want to share, and that's good. From a study that was done by Dr. Jung Lee, research in Orange in California, about health disparity on dementia care, I thought this was a very important thing that I need to quote, that there is a need to establish awareness of services and resources that are both culturally and linguistically appropriate, because we may have all the services that will support the caregivers, but they will be underutilized or continue to be underutilized by ethnic minority caregivers if nothing is done to address the identified barriers, which are language proficiency, income, and awareness. Again, language is there. We thought we're doing this right. We're translating everything, but do we get it to them? Okay, there's still something that we need. He also concluded that public funding should support culturally competent essential services to prevent negative health outcomes of family caregivers with low English proficiency. Another study, a research study, was done for the Alzheimer's Foundation by one of our researchers, one meaning PN, Philippine Nurses Association of America, among Filipino American care partners for patients with dementia. She found that all those things that we all felt before, because of how we took care and how we felt when we were taking care and seeing all these deaths and everything in COVID, they said that the emotional stress is the same. Setting boundaries is important, reframing negative thoughts. And then when you're caring for a patient with Alzheimer's or dementia, it is very, very, very difficult. And if you're a family member who felt guilt that you have to be the person to take care of them, it is doubled or more than doubled. Focusing on positive aspects of caregiving, the sources of the resilience of that, and feeling sense of purpose and connection to whoever you're taking care of, especially your loved one. And recognizing the impact of their care in their loved ones provided a sense of fulfillment. These are things that they feel. This was done in the study. To implement all this, or maybe I can say this later, implementation of all this, so that
Sure.
we give the others, because there are other resources that we need to find out, and the training also that we have available. Thank you. Thank you
Absolutely.
for listening to me.
Thank you so much, Nancy. And what you were saying really resonated with me. I have a grandmother who has Alzheimer's, and a lot of the important things that you were talking about providing that care is something that I myself and my family, we're trying to do just to make sure my grandma has a comfortable life as she ages. And she's looking to maybe go back to China soon, so hopefully we're able to fulfill her promise for doing that as well. So thank you for that. Nancy, Rhonda, I wanted to ask, being at AARP, we know that you are everywhere around the country and you guys have a lot of data. And what are some of the kind of economic, social, or political challenges that you all have found comes with caregiving, just through the data that you all have collected through the different programs that AARP has?
Well, thank you. Yes, we do have a lot of research and data and survey folks, family caregivers, our members, the public more at large. So I'm going to talk about some of the findings from some of our different research, and in particular as it pertains to AAPI family caregivers. We know that family caregivers face physical, emotional, and financial challenges. We did an out-of-pocket cost study in 2021, and AAPI family caregivers, on average, have higher out-of-pocket costs, over $8,300 annually on average, versus family caregivers overall have over $7,200 annually in out-of-pocket costs. And when we look at them, on average, family caregivers pay 26% of their income annually on average in caregiving expenses, that amount. And we call that percentage a measure of financial strain. When we look at financial strain in the AAPI family caregiving population, and we look at for women versus men, the financial strain is much higher for women. It's 32%, and it's 12% for men. So more than twice the financial strain. And one of the policy solutions that ARP supports is a family caregiver tax credit to help offset a portion of family caregiver out-of-pocket costs. It hasn't been reintroduced yet, but there's legislation called the Credit for Caring Act that would provide an up to $5,000 federal family caregiver tax credit to help eligible working family caregivers with the cost of caring for a loved one. Some of our other research, we do a study with National Alliance for Caregiving called Caregiving in the U.S., and we do that every 5 years. We last did that in 2020. And some of the findings there in terms of AAPI family caregivers, they're more likely than other caregivers to manage their loved ones' finances, and they find that task to be moderately to highly time-consuming. They also usually have help from other unpaid family caregivers, probably other family and friends that are helping them care for their loved one, but they don't tend to have paid help helping them care for their loved one. They're also more likely to find the caregiving role to be highly emotionally stressful. And also more likely than other caregivers to want doctors or other professionals to ask them what they need to help them care for their loved one. And also more likely to rely on more sources of information about providing care, like trying to get different kinds of information from different resources. And among the kinds of information that they're more likely to want or ask for includes finding non-English language materials, as well as things like helper information about managing emotional and financial stress, choosing a home care agency or a residential care facility, that kind of thing. And some of the solutions from a policy perspective that we think are important are helping family caregivers navigate so that they can get the information that they need and the resources they need when they need, how they need, if it's in a different language, if it's culturally appropriate and tailored to their needs, because that can help reduce that stress that they're feeling and save them time, which is incredibly valuable. And we support efforts to help identify family caregivers, because family caregivers don't often identify. They talk about, I'm helping my mom, I'm helping my grandmother, I'm helping my sibling, whatever the case may be. But if family caregivers, if professionals help identify family caregivers and if family caregivers are better included in their care team with their loved one, like if it's voluntary on the part of the family caregiver and on the person that they're helping, that can help better include them in their loved one's care and maybe be more likely to have a doctor or another professional see them as a caregiver and ask them, how can I help you? What do you need? It's also important, and we're supportive of expanding the use and access to culturally inclusive caregiver needs assessments. And this is where the family caregivers actually ask questions about their caregiving situation and the particulars of their situation, and what are their needs? What are their strengths? What are their challenges? And then support is that. Then from those answers to those questions, you can provide the support that they need that's tailored to their particular needs and is going to be more efficient and effective and more personalized. So those are some areas, and I'm happy to talk more, but I imagine my fellow panelists have some other important insights.
Thank you so much, Rhonda. I did want to just continue along the questioning on data, because I think data is just so important, especially for the AA and HPI community. And there's a lot of talk about just the need to more disaggregate that data so we can better help our individual communities. So I wanted to ask you, Com, we know that CRAC has been doing a lot of great work on data disaggregation. What are some of those challenges, and how are you addressing the need to disaggregate data?
Yeah. Thanks, Victor. So there are over 100 different languages spoken by Asian American, Native Hawaiian, Pacific Islander communities. There are over 50 distinct ethnic groups within our broader diaspora. And it's disingenuous for us to look at aggregated data and talk about our communities as if it really paints a full picture of the experiences that they have lived through and the challenges that they face every day. For Southeast Asian refugee communities, it makes them invisible when we cannot accurately tell how much money the caregivers in Hmong or Lao or Cambodian or Vietnamese communities have, whether or not they are struggling in their educational experiences as they're trying to take care of their family members, or whether or not they are facing immigration challenges in their caregiving as well. At CRAC, we agree with all the other panelists here about the many and significant challenges our communities face, from culturally and linguistically appropriate services and support. But ultimately, at the end of the day, it's about making sure that we have accurate data on our communities so that we can actually see what sort of resources have to be allocated to the separate and distinct communities that make up the broader AE and HPI community. At CRAC, part of our work is about, one, socializing the need to expand the way that we talk about data and data disaggregation, and shift the minimum floor from talking about just the big 6 Asian American racial categories to talking about smaller ethnic subgroups that we generally don't talk about. For example, in certain ethnic minority communities, we don't even have population data. Populations that have lived in the US for over 45 years, we don't have a basic understanding of who they are or how they take care of their elderly parents or their communities. So for us, part of this is making sure that as the federal government updates their minimum racial and ethnicity standards, that they shift the way that they talk about race and data and how they collect that data, both in the collection, the analysis, and the reporting process. The other thing I want to mention specifically to Southeast Asian American refugee communities is that, a large part of our work at CRAC is around stopping the deportations of Southeast Asian refugees. And the reason I bring this up is because it happens to be that a number of individuals we've run into who happen to be the primary caregivers of their elderly parents also have final orders of removal. Oftentimes, we're seeing these individuals be deported, essentially just leaving their parents without primary caretakers. And these individuals also happen to generally be the primary breadwinners in their immediate families as well. For us, ultimately, it's about making sure we have data so that we can make better policies and allocate resources properly to these communities, and to make sure that Asian Americans, Native Hawaiians, and Pacific Islanders can be properly supported when we're talking about how we work with them. A really great example of this is that at CRAC we're part of the Diverse Elders Coalition, and during the last Congress, part of our work was trying to figure out how can we talk about Build Back Better and the efforts to provide funding for caregivers there. And as part of our coalition, part of our effort was making sure that we allocated $4 billion specifically to diverse communities, because we know that when federal governments give funds out, it goes generally towards communities that already have access, that already have money, and our communities generally are not served in that process. Or if they are served, they get crumbs at the end of the day. And so part of our work at the federal level is making sure that we properly allocate resources to community-based organizations that we know serve our communities. And we do this by having proper data.
Thank you so much, Com. Ron, I just want to ask, with AARP being such a national organization and with so many resources available, what are some of kind of the resources that caregivers can access just to continue to help support their parents or other people that they're caring for?
Well, thank you very much for the question. AARP has a lot of resources and tools to help support family caregivers. On AARP's website, we have a Family Caregiving Resource Center at aarp.org/caregiving, where you can find lots of different tools. We have articles, we have state caregiving guides that have resources for family caregivers by state. So if you're looking for more localized resources and information, we have tips and checklists, a long-term care cost calculator, caregiving guides, again, to help you have a conversation with your family and plan for caring for a loved one. And we have different guides, including we have one, as I mentioned, for Asian Americans, one in Chinese language. We have LGBT, we have military veteran, we have in Spanish, an array of different guides to help families have those conversations. And there's on the Caregiving Resource Center, there's a lot of information also about in-home care, dementia, mobility, legal and financial areas, and end of life, all sorts of different tools, and also resources specific if you're caring for someone who is a veteran. We also have, going to one of Nancy's earlier points, we have also videos that help, are sort of instructional videos if you're helping your loved one with medical nursing tasks. AARP.org/no longer alone. And these are videos that can help you with things like, wound care, incontinence, all sorts of different medical nursing tasks that someone might be performing in the home. We also have a toll-free family caregiving sort of hotline that can help suggest resources for folks. It's open Monday through Friday, 8 to 8. It's 1-877-333-5885. We also have it in Spanish, 1-888-971-2013. Our Caregiving Resource Center is also in Spanish. We also have a family caregiving Facebook group where family caregivers can have created their own community and can share their stories and experiences and knowledge with one another. That's at www.facebook.com/groups/AARP Family Caregivers. We've also partnered with the United Way on a pilot that's being expanded as well to provide family caregiving resources through 211. If you call 211 and you're a family caregiver and you're looking for resources in your community. For those that might be interested in getting involved in advocacy to help support family caregivers from a public policy perspective, you can go to aarp.org/get involved and become an e-activist and get a monthly newsletter, articles, and action alerts for things going on in Congress and the White House, get the latest news as well. So I think those are a number of resources that we have. There's also eldercare.gov, eldercare.acl.gov, which is the National Elder Care Locator, where you can get referred to resources like area agencies on aging and things right in your community to help you find resources locally. So those are some resources that may be helpful to family caregivers.
Absolutely. Thank you so much, Rhonda. And I do also want to share just with everyone that the National Asian Pacific Center on Aging also has a senior assistance center. It's a senior assistance center where we offer language translation services for better healthcare outcomes for Asian American, Native Hawaiian, Pacific Islander seniors. So if you know anyone who may benefit or who just had some questions to ask about Medicare or wanted to talk about better health outcomes and needs language translation services, our phone number is 1-800-336-2722. And we have 6 different languages in English, Vietnamese, Korean, Cantonese, Mandarin, Tagalog. So that's another resource that you all can use. So I do want to open it up to questions from the audience. We're having a really great discussion. Thank you all so much for joining us. So I wanted to open it up to see if anyone had any questions.
I don't like using mics, but can everyone hear me in this room? Okay. I can't hear myself. But, hi, I'm Claire. I'm one of the co-presidents of the GLB, Asian American Student Association. And this is a very interesting topic for me personally. I'm an Asian American Studies minor, which is what our board established in 2017, so it's a very new minor. And I'm academically interested in kind of the development of Asian American Studies. And especially I focus on ethnic and religious tensions within Asian American history. And something that I notice in a lot of discussions about disaggregating data is that ethno-religious identity is not really something that is discussed or focused on. And I was wondering kind of like how much is the research that is happening right now is focusing on that data, and how much of Asian American Studies research is being looked to as it's very much developing year to year, new research is coming up of what we should analyze. I grew up in Philadelphia, so even in a very Southeast Asian rich community, I'm Indonesian, so I personally don't identify with the refugee experience, but everyone around me did. But when you see different analysis, compared to the Indonesian Christian community, and what support systems exist there compared to a lot of Buddhist communities. There's a big difference of kind of like the language barriers and where to go to. And I feel like those analysis is really missing in discussions of care work. So I just wondered kind of how the development of that research is going.
So I'm not an academic, so I can point you to Karthik Ramakrishnan and Janelle Wong, who are part of AAPI Data, who do significantly more work in that area than we do. But what I can say is that when we talk about this aggregating data, it's not just about making sure we have race and ethnic data, but it's about making sure we have a broader set of data that we can cross-tabulate so that we can understand the vast differences in our communities, because we know that the experiences aren't just limited to race and ethnicity. And we also know that certain communities identify differently. So even in the way that we talk about data and the types of data to collect, to analyze, and to report, it's oftentimes important for us to make sure that policymakers and academic have an understanding that communities should be able to self-identify in the way that they are being addressed, and the way that their data is being collected, analyzed, and reported. So I think, while we don't do a ton of work there, I think if part of the conversation is about making sure that ethnic minorities who have, that religious minorities in certain ethnic minority groups also are properly represented. So making sure that Karen populations are able to self-identify, even though the federal government would consider them part of the Burmese community. Because we know that when we separate that data, we have a better sense of how their communities are living. In Minnesota, for example, they disaggregate some student data and they split out the Burmese and the Karen students. And we know that Karen students generally do have lower academic proficiency scores compared to Burmese students, despite the fact that the federal government would consider both of them, both populations, just one national origin group.
Hi, my name is Leigh Danielle. I am a senior at the university, or I'll be a rising senior. Let me not get ahead of myself. At the University of Maryland, College Park. I will be next year's president of our Asian American Student Union, and I was also served as the director of public relations on our Filipino Cultural Association on campus. So this question is about Filipino nurses, but I'm open to hearing everyone's thoughts on the panel. So as Nancy told us, Filipino nurses have been disproportionately affected by the COVID-19 pandemic. But in recent news, there was a nurse from the George Washington University Hospital, Angelo Estrellas, who was illegally terminated by the GW administration for signing a petition and to help unionize the rights of the nurses and the efforts there. So I would just kind of like to hear about, I know you all talked about resources available for your care, for the caregivers, as well as data that's being collected, but how else are you and your organization supporting the unionization efforts that these caregivers may push out and seek for?
I will try to answer or give you at least some information about your question. So the Philippine Nurses Association of America also has this part of our services where it's called what is it, Carol? The Human Rights Committee, where if there's anything, whatever it is, it may not be human rights, that they come to us and bring it to us, and we provide assistance if we felt that that is what it is, and for free to begin with, and then and help them find help also for that purpose. So I hope that helped, because unionization is a little different than the other things, but there's a lot of nurses who work for hospitals who are unionized. So, and so that's all I could say. Since I'm for the foundation, I cannot say much about those kind of things. But I'd like to say something about religious, okay? And in the religious, for some reason, I haven't seen a lot of that, but always in our studies, it shows something about religion and how it affects the whole thing. And I'll be happy to share with you some of those results. Okay, thank you.
Thank you so much. I think maybe we can do one more question, and then we'll have closing remarks.
Thank you so much. My name is Nelson Garcia with Compassion and Choices. Also Filipino. I have an aunt who's a Filipino nurse in New Jersey, caregiver. She's in her 70s. And because of the shortages, she's been asked to come out of retirement to help provide some support for patients. And so two-part question. Number one, are there any additional resources that she can tap into to help alleviate some of the, we mentioned about tax breaks and financial costs out of pocket, and just basically emotional support system among her peers or people from the community that they can tap into. And secondly, in order to make up for the shortages, are the visa requirements from the Philippines, for example, to bring nurses into the United States, has that been increased in order to allow for more Filipino nurses to come to the United States to provide caregiving for the population?
Okay, for the first question, the Philippine Nurses Association, especially in New Jersey, where we have our headquarters, we also have support for them. And throughout, because of this pandemic, we have what we call Kabalikat program, which is peer-to-peer support. And all she needs to do is to give us a call. And Carol here is our marketing person, and she can connect you.
If I may just add quickly, the other issue for her is that she's also taking care of her husband, who is in her 80s, right? And so now we're not only taking care of other people, now she also has to be concerned about her own family needs.
Yes. And so they are there. We have a lot of chapters in New Jersey, sub-chapters in New Jersey, and they're working hard, and that will be. I'm close to 80 myself. Maybe in a couple of years I will be there. And so this information is very, very important to me as well. What was the other question? I forgot.
About the visa.
The visa. I think they're working on that, but we are very, very careful. Because of that, there are many what we call non-ethical recruiters who do that. So the Philippine Nurses Association of America have done and created a handbook that, and also a committee that is very, very active in this. And would you like to share more about that, Carol? Because you're intimately, she is the president of the PNA Metro DC. Okay. And she's intimately thing with the committee that for the immigration and all that.
So I think with the visa right now there's retrogression. So they're not processing like new ones now. But on our website, mypnaa.org, we have a lot of resources there. And the handbook that Ms. Nancy mentioned, it can be downloaded free, and it's really good for those who are just coming here to the States.
Are you working closely with the embassy here in Washington?
Yeah,
Yes. And PO,
Yes.
and the Polo and all those.
Yeah.
Very closely with them. Yes. Thank you, Carol.
Thank you all so much. I believe this concludes our panel due to time restraints, but we do thank you all so much for just joining us today. And our panelists will be up here, so please feel free to come up, introduce yourselves, ask questions. So thank you all so much.